I want to tell you about a 22-year-old healthy college student with fatigue. What does he have in common with a 38-year-old man that has headache, dizziness, and fatigue? Hello, everyone. This is Dr. Mitch Freeman. I'm board-certified family physician. Would like to discuss with you what's common in these two cases. Today, I saw a patient who was a 38-year-old man complaining of dizziness, headache, and fatigue. He reminded me with a 22-year-old college student, a healthy college student, complaining of fatigue. I want to discuss what are the most common conditions that I see as a family physician. I don't like talking about rare conditions that people see it rarely. The most common things is the most common thing that you see and that happen to people. Both of these patients, what they have in common is sinus allergy. As simple as it may sound, sinus allergies, yes. Sinus allergies make people dizzy, fatigue, and headache can cause it too. I spoke in a previous video, I will put the link up here, about how to treat chronic headache. And the main thing how to treat and manage chronic headache is treat your allergies. Allergies will give you chronic headache. Also, allergies will give you dizziness, like feeling like you lose balance easy when you walk, or like bending over, getting something, you will kind of lose balance. Or just could be fatigue. Why would it give you fatigue? Allergies, sinus allergies, they also call them hay fever, seasonal allergic rhinitis. Different countries, different places, they call them different things. Here, they call them sinus allergies, or they just say allergies. And a lot of people, or maybe families, have allergies. Everyone in the family have allergies, and they think it's just normal to have the sniffles and congested and runny nose. You wake up in the morning hacking and coughing, and because everyone in the family is doing the same thing, so they say, oh, it's just normal. Everyone's doing the same thing. It's not normal. Allergies can cause all these things. How is allergy can cause fatigue? So when we sleep is 4 stages. Stage 1, 2, 3, 4. So you want to be hitting the deep sleep, stage 4, to feel recharged, to feel revived, to feel better when you wake up in the morning. But you could be sleeping 7, 8 hours. If you're not getting a good deep sleep, you're not going to wake up feeling refreshed. So allergies, what it does, you get congested in the nose. Worst congestion, the time of the night, of the day that you get congested is between 2 and 3 a.m. You have the lowest level of cortisol in the body, and that makes you have the worst congestion or asthma or achiness, arthritis. That's why a lot of these conditions related to inflammation, it gets worse around the 2 to 3 a.m. So when your allergies get worse in your sleep, it makes you sore throat, it makes you have dry throat, and it affects your breathing and snoring, and it interrupts your deep sleep. So if you're sleeping soundly and you start snoring and like doing that, and then you shift sleep from deep sleep to a shallow sleep. So you're still sleeping, you still don't remember. You might be bothering your partner, you might be scaring someone next room. I remember I was in a refugee camp. A guy was thinking there was a snake somewhere there, and it was someone who was just snoring at night. He was snoring so loud that this guy was thinking there was a snake somewhere there at night. So allergies and snoring make people not get deep sleep, not get good quality sleep, and it makes them shift to shallow sleep, stage 1 and stage 2, and they wake up tired. Also, bags under the eyes. I want to make one day a video about, I see reporters on TV that have bags under their eyes, and it's just allergies, if they know it or not. If you don't treat these allergies, you will have the bags under the eyes, the fatigue, the dizziness, the sore throat, dryness, snoring worse, wake up not feeling good. When you catch a cold, the cold will linger for a long period of time because your sinuses are not primed well, they're not open well, and it doesn't take much to get them congested. When you get a cold on top of the congestion you These symptoms will prolong, and most of those people, they ended up with a sinus infection, and they ended up taking a lot of over-the-counter medicine. They needed to go to the doctor and get medicine to get out of that sinus infection. So the treatment for allergies, 9 out of 10, 90% of people, if you get the sinus rinse and the over-the-counter nasal spray, steroid nasal spray, the most common one and my favorite is fluticasone, but they all would work, like Nasonex, Nasacort, fluticasone, which is generic Flonase. Another thing with sinus allergies is you get postnasal drip. It makes people drip in the back of the throat and makes them get cough, especially the kind of cough that it get people choking, like they cough so much they can't breathe, they can't talk, or they cough so much they could be breaking a rib coughing. One day I was working in the emergency room. I had a patient that was brought in by ambulance for chest pain. It was an older Hispanic lady with like 6 members of the family following her. Once the paramedic put her in the room, I went and walked in, stood by the door. I just looked at her honestly from the door, looking at her from the door. I'm looking at how she breathed. She's coughing so much she was having chest pain. She was brought in for a chest pain. And coughing, choking, chest pain, and everyone was freaking out like, Grandma's having a heart attack. Grandma's having chest pain. Grandma can't breathe. I'm looking at her from the door. I told him, you might not believe me, but I think she has a sinus infection. I'm not going to tell you, just take my word for it. We'll do a cardiac workup. We'll do EKG. We'll do cardiac enzymes. We'll also do a sinus CT scan. And we did everything and showed them at the end there was nothing wrong with her other than sinus infection that was making her cough and congested and cough so much that she was having chest pain, can't breathe, and it was just sinus infection. And those people that they get those kind of sinus infection, usually people with allergies that's not well controlled. When you don't control your allergies, you'll get frequent sinus infection, recurrent throat infection, and it's all the allergies. So treatment of allergies, Flonase nasal spray, fluticasone nasal spray it's called, morning and night. I would do it regularly for the rest of your life. Don't wait until you get bad to do it. Do it every day regardless. If you're doing fine or not, just do it every single day. If you think your allergy is not bad, at least do it just at night. And if the Neilmed sinus rinse, you do that every day when you take a shower, before you wash your hair, before you wash your head. Other things that would help, if you know like you're allergic to dust mite, doing hypoallergenic sheets for your sheet bedding. Not the sheets that you cover yourself with, it's what covers your bed and what covers your pillow. Also, if you're allergic to dust mite, I would avoid any furnitures that are not leather, covered with leather or pleather, just like no fabric, and cover with hypoallergenic sheets. So treat your allergies, your headaches will get better, sinus congestion will get better, you snore less, you'll have better energy, you won't have baggy eyes, and you won't be catching sinus infection easy, and you won't be getting frequent throat infection, frequent sinusitis. Contents, please like and subscribe. And if you have any suggestion for any future video suggestion, been a doctor for 34 years. My head is like an encyclopedia of medicine. Give me any suggestion for any videos to make, and I will be making videos in the future. I won't be doing videos about rare conditions. I want to do videos about common conditions, so the most number of people and the larger number of people will benefit from it. Have a good day, and we'll talk to you on the next video.